My name's Anne Falloy, and I set up Oliver's Future in memory of my son Oliver, who tragically took his own life just 2 days before his 23rd birthday. And this was after just 4 days of taking citalopram, which is an antidepressant that he'd actually been prescribed over the phone by his doctor. I feel it's my duty to him and to others to change the way that doctors can prescribe to a first-time patient even, which was in the case of Oliver. Someone suffering from depression or anxiety, they can, as it stands, prescribe over the phone, and I think this is so wrong because anyone that goes to a doctor's needing help should be seen, especially if they're going to be prescribed medication. And what happened in Oliver's case was he'd seen a doctor early in January. He'd then been called in for a blood test to check his thyroid, which had proved negative. And when he'd phoned again, just a few weeks later to make another appointment, the doctor there said, "I will write you out a prescription and you can pick this up at the in-house pharmacy," which he did. Ollie's Future now is doing the right thing in campaigning that the best practice for doctors should be that they see their patients face to face if they are going to prescribe them an antidepressant. I do that in my son's memory, but I think it's just common sense. How can any doctor be sure that the conversation they've had with someone, especially a young person, has been taken on board by them if they're not looking them in the face, if they're not making eye contact, if they're not seeing them, seeing their body language. These are just basic human instincts, and I do want to see a change now and make sure that a nice guideline is in place, which at present is not the case. I do this for Oliver.
My name's Courtney Buckler. I'm a PhD student and I'm also working with Ollie's Future on their campaign to ensure that young people, or anybody for that matter, who are prescribed antidepressants for the first time are seen face to face. And why do I think this is important? As a young person who has a long history with self-harm and suicide attempts and thoughts, people often ask me, what can I do to help? And the amazing thing is how simple it actually is. Often when I come to people, particularly doctors, looking for help, I'm bewildered and confused, overwhelmed and scared. And what I really need is I need patience, reassurance, and someone to sit and listen to me. And I think the thing that's so important for me to get out in this campaign and for us to work with Ollie's Future is to say that the treatment that we get is not the prescription we walk out with or the thing that we, the referral that comes next. It's what happens in the room. And it's so simple and it really can't be done over the phone. Like Anne says, we need someone to look us in the eye and to say that they see what we're going through. And I think the thing about antidepressants, we can talk about them being powerful, but what's more powerful is to sit there with somebody else who sees us in our pain and doesn't shy away and offers that reassurance and connection that we so desperately need when we feel doubtful or overwhelmed or judgmental of ourselves. And just like Anne, I do this for Oliver and I do it for myself and I do it for all other young people or anybody for that matter who feels like they can't go on.